Good evening, and welcome to Real Sports, where we begin tonight with the story of an unusual and innovative medical program that's aimed at former professional athletes. It's one that helps them deal with an all-too-common trio of related problems they face when their playing days are done: chronic pain, an addiction to pain-killing drugs, and a lack of insurance. Historically, it seems football players have paid the dearest price for the punishing toll their sport has taken on their bodies. Many limp away from the game with their bodies badly in need of repair. Lacking the insurance to properly address their needs, more than just a few become dependent on drugs to alleviate their misery. For them, a medical group called P.A.S.T has become a godsend. As Armen Keteyian reports, there are some doctors in New Jersey who are making a difference.
Ironically, it all started with Real Sports. A few years back, I saw a show Bryant Gumbel had, and it talked about NFL players. It talked about the despair of the NFL player. Looking at that piece and a few other pieces that he had, I was quite moved by it. I mean, something just really struck me.
Dr. J Focazio is a prominent gastroenterologist in New Jersey. What struck him was a series of reports on our show revealing how some former NFL players were struggling with a witch's brew of problems: debilitating injuries, financial distress, and loss of memory.
Repeat the months of the year.
January, May, April.
The physical price that these guys pay is far greater than anyone could imagine. It's unconscionable.
Bill, you're not one of the big famous sports doctors.
No, not at all.
You're a GI guy in New Jersey. How do you find yourself in the middle of this?
I saw the need, I followed it, and I'm handling it the best way I think it should be handled.
So 2 years ago, Dr. Focazio came up with what one might call a new prescription for treating men broken by the game. He started calling colleagues, top New Jersey docs in their own right, asking if they wanted in on a team he was forming. His idea was big and potentially game-changing. Take care of the guys we all loved watching on Sundays, but do it for free. The exams, the MRIs, drug and alcohol treatment, expensive surgeries, all free. They call the group P.A.S.T, Pain Alternatives, Solutions, and Treatment.
I'm a cardiologist.
Radiology.
Spine surgeon. Psychiatry.
Pain management.
Neurology.
Internal medicine, gastroenterology.
Orthopedic surgery, sports medicine.
Does it take a group like this in order to put these guys back together? Because you have cardiologists,
absolutely.
Neurologists.
Yes.
Because some of these cases are very complicated. But we look at each other and say, I don't know, what do you think?
And we're smart people.
Yeah.
Everything overlapping. I mean, you could come in to treat a knee, you come in to treat a back or a neck. And the behavioral issues, the depression, the family issues that are subsequent to that, the drug dependency, all of these things have to be addressed.
For the doctors, it was an awakening. The undeniable need to treat these men not just physically, but mentally as well. How for so many former players, the lack of medical care had opened the door to addiction.
Vicodin, Percocet, Roxy's, oxycodone, Soma, Flexerol, whatever I could get my damn hands on. I mean, the pain was that bad.
Ray Lucas played 8 years in the NFL for 4 different teams. At times, he was electrifying. An undrafted, headstrong Jersey boy who hit it big. Now retired and on the air, just last summer, Lucas appeared the very picture of post-career success.
And in the second half, that's exactly what he did.
Never once hinting how at only 38, his life was falling apart.
I would stop taking the pills the night before, but when I got off the set and going to get my truck to drive home, I was taking a handful, 15, 16 pills at a time.
So you're a functioning addict.
Oh, yeah. You know, 450 pills a month is not a game. That was my life. That was my life. Every friggin' day. And the only time I got out of bed was to go do my TV show. The only time. So family life was none. Father wasn't there. Husband, not there.
Despite the love of his high school sweetheart wife and 3 adoring daughters, Lucas says his slide started in 2009 when his 5 years of NFL insurance ran out. Soon after that, his neck started to feel like it was on fire, leading to days in bed, a deep depression, an ever-increasing appetite for relief.
You know, I bankrupted my family because I needed the medicine. I mean, there was times when I was going to shave and I couldn't shave because I didn't like who I was staring back at. I wanted to punch him right in the face.
Like other former players, Lucas says he reached out to the NFL, the union, and player advocacy groups for counsel and care, but was unable to get the neck surgery he so badly needed. Then Lucas says he got a tip. Call Jennifer Smith, the player coordinator for Dr. Focazio's group in New Jersey. In desperation, he did.
I called Jen and I said, I'm Ray Lucas and I'm in trouble. You're my last hope. I'm going to kill myself.
Lucas even had a plan. He'd get in his car and drive off the GW Bridge.
I was thinking going GW, make a right in the middle. You know what I'm saying? Just, like, you know, screw it. And, you know, I didn't want to kill myself in the house because the girls would be there. And she calls me back and she said, we're going to help you. And I was like, what? You know, what'd you say? She's like, we're going to take your case.
What Lucas found when he met Dr. Focazio and his team was shocking. A group of specialists with practices a short distance from each other, all working together.
Ray did great. Thumbs up, man. You did terrific.
Thanks, Doc.
Is it possible to put a value on all this pro bono work?
Well, we've figured it's about a little over $2 million so far.
In 2 years?
Yeah.
When you began this, you had to have some idea in your head what you were facing. Is this need bigger than you could have possibly imagined?
I guess if I thought about it too much, it would have scared me.
And that need, that demand really, was never better illustrated than when Focazio and his team met Randy Grimes.
What threw everybody off was the toxicity of my body because of my drug addiction.
When those numbers came back from the tests, what did the doctors say to you?
Other than, holy shit, you know, they said, Randy, we can't believe that you're not dead.
It's hardly a reach to say Randy Grimes gave his life to the game of football. High school, college, 10 years on the offensive line for the Tampa Bay Buccaneers before retiring in 1992. The constant pain and pills, all part of the deal. By the time Grimes was examined by P.A.S.T in 2009, he was a certifiable mess. His neck and knees either locked up or blown out. His system polluted by up to 600 pain-killing pills a month.
The first recommendation was, you know, we know how to fix you, we can fix you, but we can't fix you, we can't put you under, we can't put you on an operating table until you go down and get clean.
Down in this case meant a trip to a South Florida rehab facility with ties to Focazio and P.A.S.T. This is video of Grimes right before he checked into treatment.
5, 10, 15 Norco, just to get me out there. I just taking my last 10 because I know that once I get there, that's the end of it.
Headed to rehab, and I was going to make sure that I didn't walk in with any pills, so
Instead of throwing them away, you just
down they went.
Down
That's
the hatch.
right, down they went. Because I didn't know you could get up every day and function like a normal human being without taking a handful of medication.
Grimes spent a month in rehab until he was clean enough to safely undergo complicated knee replacement surgery. All told, according to P.A.S.T, Grimes received more than $300,000 worth of surgeries and treatment on his knees and neck.
You know, and I had detoxed before, but you know, I always walked out on the same bad knee with the same bad neck and the same bad back that I went in with.
18 months after drug rehab and the surgeries, Grimes is back in Florida, working as a counselor at Behavioral Health of the Palm Beaches, the very same place that helped him get clean.
Our disease, the tentacles of it just reaches out and strangles everybody in the family. And
on this day, Grimes is running a peer group for former pro football players, all patients of Dr. Focazio's, all addicts, struggling with the physical and psychological price of playing a game they love. Guys like Ray Lucas, his pain reduced by surgery, and at this point, clean for 4 weeks.
And the scariest part for me right now is how many others
that's true.
need to be in this room.
And Craig Sauer, a former linebacker for Atlanta and Minnesota. Sauer says disc, spine, and drinking problems left him just this side of sane not long after a 5-year career ended. Through P.A.S.T, he's gotten neck surgery and extensive neurological care.
There was no life. I was just existing. I couldn't hold a job. I couldn't be a father, and I was pissed. I was mad. And
Look at you now.
Yeah.
Look at you right now.
Feeling like you're left to die, you know, when you gave everything you had to it. And I'll be honest, it's scary, because when you and you cry a lot, son of a bitch, if they could find a drug for that, I'd be all right.
Long-term player care remains an emotional issue in the NFL and a heated topic of the current labor talks. Lucas and Grimes both received money from the NFL to help pay their bills. About $5,000 for Grimes to pay for the halfway house he lived in after treatment, and $16,000 for Lucas to pay his mortgage and utilities for 3 months. The NFL reimbursed P.A.S.T for $35,000 in expenses and says since 2008, the Player Care Foundation has granted $2.7 million to 277 retired players and spent another $2.4 million to screen 1,500 players for prostate cancer and cardiovascular diseases.
Dr. Focazio, the NFL says it has done a lot in the last few years. It has the 88 plan for dementia. They've done joint replacement. They've done health screenings. They've done neurological exams. To which you say what?
Why are the players coming to us? If they have all these programs in place, why are they coming to us? I mean, I think their intentions may be good. I think that there's a lot of people who make care on the NFL, and I'm sure they do.
But Focazio is not without his critics. The doctor's former executive director says he believes that Dr. Focazio is in this for money and publicity.
Bill, how do you feel when people question your motivations here?
People that know me know my intentions. They know that this is real, and it's from the heart. It's just the way I am.
You're doing.
I'm doing well, yourself?
Thank you so much.
Every month, more and more retired players arrive in New Jersey. Last month, it was J.D. Hill, a former Buffalo Bill, who came in from Arizona. Yancey Thigpen, later the Steelers and Titans, flew in from Atlanta. The total number of retired players for Focazio and company is about 100 now and rising. And it's not just football players. P.A.S.T is also working with former pro basketball and baseball players, all drawn to a special group of doctors willing to listen, not concerned as much about insurance or co-pays as integrated care.
What's up, my friend? Oh, man, how you doing? Good, how are you? As a physician, you get to talk to a lot of people. You get to see a lot of things and a lot of hurt. So when you see joy like this, you grab onto it.
Today, Ray Lucas is out of treatment and back in Jersey with his family.
There's a road,
A metal plate and 6 screws in his neck. But, he says, not a single pill in his mouth. 10 weeks and counting.
The fog has been lifted. I am so crystal clear about what I want to be. And you know, it's really simple. I want to be a better husband. The husband that my wife deserves, that stuck with me through all of this crap. And I want to be a daddy. And it's that simple. They saved my life. I can't put it any other way. I'd be dead right now if it wasn't for P.A.S.T. I'd be dead.
Armen, how do these doctors decide who to help? I mean, there must be a flood of guys in need.
Well, yes, there is. I mean, simple answer. They're coming in from all over. The word of mouth, you know, stories about P.A.S.T that have been in other places. I mean, there's no question that there's a need here.